Responsive behaviors is a term that actually originated from persons who have dementia themselves, and it's a term that we prefer to use because it gets at the fact that somebody is responding to something that's important to them, whether it be in the environment or something that's internal to them, and it changes the way that we understand behavior. That problem that we tackled, we did through a staff education program and associated processes of care to improve person-centered care for people who demonstrate responsive behaviors.
What's been helpful for us in doing the high observation rounds is that it's given our team a chance to come together and work with patients and families to come up with strategies that work for them. The most valuable part for me has been that people are talking about it more and people are problem solving more together, whereas I think a lot of that used to happen in silos. And so I think recognizing the different skills that each health professional brings and can use to help serve patients better has been a really valuable experience for me.
How can we address responsive behaviors in the acute care environment? It's a relatively new conversation for hospitals to be having, and I think that we can really position ourselves as leaders who've done something innovative, who've used a collaborative approach to address a challenge that was concerning to both staff and clients and families.
I've never had an experience with a student support website such as this one. It's new, and I feel like as a student coming into St. Mike's, it's very helpful as someone who is starting a rotation. Usually we have a lot of questions before we even come to ask our preceptors, but this way we're oriented even before we start.
So I feel like this really supports me as a health discipline student because the website really makes me feel like students are important at St. Mike's Hospital. And even before I got started here, I already felt like I was part of the team and I already had answers to my questions. And I really like the different sections because me as a physiotherapy student, I can go specifically to the health discipline section for my own profession and get all the answers I need without having to filter through everything else.
I love that I can access the site from my own cell phone and I don't even need a computer, and I can look for answers wherever and whenever.
The reason we in our department got involved in the use of the esophageal balloon is because we wanted to be able to help our critically ill patients who are ventilated and who have developed ARDS. We wanted to be able to do more for those patients because they're really difficult to manage.
We are able to bring in the nurses and the doctors and actually kind of teach them as we do it as well.
People will look to us in our center for training and understanding of how to use it and perhaps implement it in their own centers.
But our role is instrumental in actually performing the measurements. So we actually insert the esophageal balloons at the bedside, and then we are responsible for doing all the maneuvers on the ventilator to produce the measurements that we use to guide us.
Our role also includes helping identify patients that would potentially benefit from having the measurements done on them. And then we bring our results to the team, the medical team, and we discuss sort of strategies from there on end.
So the project that we got involved in was the Health Disciplines Holiday Coverage last year. This was a new initiative for the health disciplines. And what drew me specifically to this initiative was being able to see the possible positive impact that it would have on patients and families.
The most striking thing for me was a patient who we were able to give a speaking valve to along in combination with the RT, who was actually able to communicate the next day verbally. And we had everything set up for her to have a swallow study with radiology just after the holidays. That wouldn't have happened if we did not have coverage across holidays.
But the fact that the consistency was there, you could see that the therapists, for in my case, could come back on Monday and possibly see this patient for discharge because now they had actually progressed over the weekend. So I can see this as being positive and actually something that we would actually continue here at St. Michael's Hospital.
There was a lot of excitement from the physicians, from the nurses, especially because it facilitated the flow of patients. Across the 2 holiday blocks, 175 patients were seen for a total of 312 visits by members of different disciplines.
So I think we know that emergency situations and crisis situations and patient care needs don't just happen during business hours. So previously there wasn't a social worker in the emergency department past 4:30 or 5 p.m. So now when a patient comes in at 5:30 or 7:30 or 10:30 at night and they have those psychosocial issues, it could be looking for housing or shelter, they might need grief support, they might be an elderly person going back to an apartment all by themselves after their visit. There's now a social worker on the team who can support them with their needs. St. Michael's Hospital as a whole has decided to create a permanent position. So I'm so excited, I'm so happy for patients and families, and I think it's going to be great going forward.